A report from the Wisconsin Policy Forum shows student vaccination rates are still below pre-pandemic levels in our state. In the 2022-2023 school year, about 10% of students didn't meet the minimum requirement for K-12 school enrollment. That's an improvement over the previous year, but it is still higher than every year in the previous decade. To talk about immunizations across the board, the Wisconsin Department of Health Services Immunization Program Manager is with us, Dr. Stephanie Schauer. Thanks so much for taking the time.
All right, thank you so much for having me.
So the new report out from Wisconsin Policy Forum calls renewed attention to something health officials already know, that childhood vaccination rates are lagging. So in a general sense, Dr. Schauer, how does the state work with local health departments to address this issue?
Yeah, so it's important to note that this is something that we are seeing here in Wisconsin, but is really a symptom that we're seeing nationwide, and it really involves, players from all over, whether it's healthcare providers, it's local and tribal health departments, and community partners. And it's making sure that families are aware that kids still need vaccines, that they should be checking immunization records, and that it's important that we get kids back into care where they can be assessed and ensure that they've got the vaccines they need. We also are working with schools. Now is the time where schools are reviewing immunization records to make sure that all of the children that are attending have the recommended or the required vaccines, and working to ensure that if they don't have those, that they know where they can get those.
What can lawmakers do to help health officials in improving these vaccination rates?
Yeah, I think people look up to their policymakers and legislators, and I think continuing to encourage people to have their children vaccinated. Vaccine is one of the best ways we have to prevent many diseases, and so encouraging folks to take care of themselves and their communities is one way that we'd like to ensure that that message is put forward.
Dr. Schauer, let's talk about COVID-19 vaccines now. During the pandemic, the federal government was buying and distributing those doses. That has now changed. The responsibility has been handed off more to private companies, but many places over the last few weeks have been having trouble getting supply. There's been a lot of news about dropped or canceled appointments. Is Wisconsin dealing with the limited supply right now, or are you seeing supply chain issues ease?
Yeah, so this is a national issue. The vaccine manufacturers, all three of them are, producing and shipping vaccine, albeit at a much slower pace than I think we anticipated or would hope. We do have, word from CDC that things are getting better, but we understand the experience here in Wisconsin is much like we are hearing from the rest of the United States, that vaccine is coming, but a bit more slowly. And so we really encourage, individuals to reach out to their healthcare providers and find out when they will have vaccine and to make an appointment. If their insurance happens to cover vaccine administration at a pharmacy, make sure you know which one, and then see if those options are available. Often appointments can be made online or, via the telephone.
Are you concerned at all that health officials are still battling vaccine hesitancy? Are you concerned that that, coupled with some of these supply issues, might lead to less people getting a COVID-19 vaccine this season?
Yeah, I certainly hope not. I think it's important to remember that the COVID-19 vaccines are the same vaccines that we've been, experienced with over the past couple of years. They're just changed a bit to go ahead and better address the new variants that have been circulating. So we've got the 2 mRNA vaccines, and then we've got the protein vaccine from Novavax, and those are all very similar to what we have been seeing. And hopefully people have experience and will feel comfortable moving forward. As we go into respiratory season, it is important for folks to understand we've got, a number of diseases that we can provide a vaccine against, whether it's influenza, it's COVID-19, and then for certain populations, the RSV vaccine is available. And for very young infants, there's a new monoclonal antibody that can provide protection. And so I think we're hoping that people are enjoying being out and about and not wanting illness to slow them down, and that vaccines are a good way of keeping healthy, both for you and your family.
How can people who are uninsured or underinsured still access a COVID shot?
Yeah, that's a great question. So, Wisconsin is participating in a federal program called the Bridge Access Program, and this allows or underinsured adults to receive the COVID-19 vaccine at no cost. And so, individuals can go ahead and look on vaccines.gov and find a Bridge Access provider. It's many of our local and tribal health departments and federally qualified health centers, and we're continuing to enroll new sites as we go along. But they can go ahead and avail themselves to one of those providers and receive the vaccine. It also covers individuals who may be insured, but they still have an out-of-pocket cost, so they may have a copay or a high deductible or a deductible that they need to meet, and they are also eligible. So we're really excited that uninsured adults can take part in that program.
Dr. Schauer, it's a triple respiratory illness vaccine season. Flu, RSV, COVID-19. Are these things that people can get all at once?
Yeah, yes, they certainly can have them be administered all at once. That there's no problem with that. I would just say that there are a few challenges regarding the RSV vaccine and being paid for by insurances right off the bat, and so just check with your insurance company about if they're paying for it now and what location. I think one of the important pieces to keep in mind, and this is for COVID-19 and flu and other vaccines, is that for insured individuals, you probably have coverage for those, but the where is important. Do, do, do you need to get it at your healthcare provider, or can you get it at a pharmacy? As Pharmacies are great options for vaccines, and many insurance companies do allow that. But go ahead and check with your provider, or your insurance company, to make sure that you've got that figured out ahead of time.
Dr. Stephanie Schauer with the Wisconsin Department of Health Services, thank you so much for the time and expertise this morning.
Thank you so much.